So the Orthopedic Trauma Fellowship at University of California, San Francisco and the Orthopedic Trauma Institute is one of the most advanced fellowships in the country.
Our Orthopedic Trauma Fellowship offers a diversity of thought, a diversity of clinical experience. We have one of the largest fellowship-trained orthopedic trauma groups in the country. We draw our faculty from several different schools of thought.
The reason I chose the OTI for my trauma fellowship is multifactorial, really. Number one, they have a lot of faculty, and the faculty all come from different training backgrounds. So I really liked the fact that I was going to be exposed to a broad experience and a broad diversity of faculty.
So I chose UCSF for my fellowship because they have a good volume of cases and all of the faculty have varying backgrounds, and so you get a bit of training from East Coast, West Coast, and it's a good variety of different perspectives on cases.
We have a urban level 1 trauma center which sits at the hub of the fellowship. That's the Zuckerberg San Francisco General Hospital. We have a very busy cold trauma practice that's run through our University Medical Center.
We have the opportunity for individuals to experience trauma care in multiple environments.
There's residents everywhere. There's a huge research powerhouse. There's lots of time to work on research. You work closely with not only faculty members, but also engineers in the biomechanical lab. And you really have the opportunity to explore the academic side of orthopedic trauma.
You have an opportunity to work in biomechanics labs, molecular biology, a clinical research group. You can do procedure-based research in our surgical training facility. From an educational standpoint, there are teaching conferences every day. There's opportunities to go to external meetings, including the Orthopedic Trauma Association meeting, the Orthopedic Trauma Association Fellowship meeting, the American Academy of Orthopedic Surgeons. There is the opportunity to teach at and attend the San Francisco Orthopedic Trauma course at the end of the year and interact with all the amazing faculty.
The other 6 months is done at Regional Hospital in San Jose, and that runs much more like a private practice hospital.
We have a very busy level 2 trauma center experience that our fellows have the opportunity to spend up to half of their fellowship at, which gives them the sense of what having a practice out in the community or out at a busy non-academically affiliated level 2 trauma center might look like.
And the unique experience of being in San Jose, which is a private hospital, versus UCSF, and working with residents as you learn to do things with less help and be a little bit more autonomous in the OR.
There's no residents, so really it's just myself and an attending who basically do the entire day's work. So we round on patients together, we see patients in clinic together, and then we're operating together and seeing consults. So you really get the exposure of what it's like to work in a non-academic setting, which is really something that most people, I feel like, don't get that experience through residency. It's almost like 2 fellowships in one.
So yes, I do feel prepared for practice. I think the nice thing about this fellowship is you get a graduated level of autonomy throughout the year. So as we approach the end of the year, we're starting to take attending of the day call and being on call with just the residents.
Probably one of the best pieces of advice that I can offer an incoming fellow is to really latch on to the faculty. I think one of the most important things, aside from the learning that's done in fellowship, that you can walk away with is also the relationships.
The fellows will have developed mentorship relationships, and so probably throughout the entire spectrum of their career, they're going to have an opportunity to interact with those mentors and utilize that mentorship relationship that they developed for their benefit and for the benefit of their patients.
Living in San Francisco has also been a huge bonus to the fellowship. San Francisco is outrageously fun place to live. I live in Mission Bay, which is subsidized student housing or graduate student housing, which is really nice. It's a lottery system, but once you get in, you have the opportunity to live right on the outskirts of downtown at a very affordable price. That gives me the opportunity to, when I'm not working, be right at the epicenter of San Francisco and really experience everything that it has to offer. I go out to dinner regularly with my wife, and I feel like we can go out to dinner almost every single night for an entire year and not go to the same place twice.